Patients often think about their surgeries just before the summer. Liposuction, breast prosthesis increase greatly in April and May. They don't have much opportunity to heal until the summer. In fact, the winter months are better for these type of surgeries. For instance, January, February, even December. If you have surgery in these months, you will heal by summer. Swelling will go away, stitches will fade, you will feel much better. Among these surgeries, the one left for the last minute is Ets surgery. The most common treatment we perform is for armpit sweating. Now, there are several methods that are performed in these patients. The point is to rupture the sweat glands in the armpit, that is the essence of the operation. Lately, the most common method is the removal of the underarm sweat glands by liposuction. Very thin cannulas are used for this purpose. These sweat glands are removed using thin cannula by vacuum through a small 1 or 2 millimeter hole. Sometimes it's used to rupture by laser by liposuction. In fact, this operation is not taking very long. It ends within 1 and 1.5 hours. We rupture the underarm sweat glands with liposuction, but by doing this, we go a little beyond the classic rules of liposuction. What is that? Normally, in liposuction, the hole at the end of the cannula should face the fat, that is, downwards, so that the skin is not damaged and the fat underneath is removed. However, when we are removing the sweat glands, we do the opposite. The whole of the liposuction cannulas must point upwards because we are going to be scraping out the subcutaneous sweat glands. That's the goal. And we are going to be scraping very close to the hole. In liposuction, we remove the sweat glands, and finally, this is a procedure that does some damage to the skin, and it's supposed to, because you are rupturing the sweat glands just under the skin. After the surgery, this is what happens. This is normal. This shows that your sweat glands were taken from the right place. The stitches are very small. It's a suture. There's always a chance of infection because you remove the sweat glands. And why? Because there are microbes in the sweat glands too. It has normal skin flora. We prescribe antibiotics to the patients and ask them to use it properly. I've never had an infection in my patients, but I make them use the antibiotics strictly. I check, call, and ask if they are using them. If the patient takes the painkillers properly, he will not have much of a problem. There will be a little swelling, edema in axilla, and redness in the form of lines. But he will get through the recovery period without any problems. In these patients, the next few months are like this. Sweating undergoes a kind of filtering. It increases and decreases, goes through a period of dryness and so on. But then it comes back to normal. All the sweat glands ruptured within were also destroyed. They mixed with the blood and were flung away. The part which was sucked off was removed. When the recovery here was finished, the sweating went down to a normal level, and that the level remained the same. It doesn't change for a long time. It decreases over a year. Anyway, our goal is not to stop the sweating at all, but to reduce it. But normally we want it to go down to normal. We don't want the patient to be drenched in the armpits and clothes all day. What happens could be just normal sweating in this area. Anyway, our goal is to get down to the normal level. My point is that there can be no total dryness. That's not the point anyways. It's not a very problematic procedure. It's just that some patients, this happens over the years, a cyst develops in the sweat glands. It becomes abscessed. Sometimes it gushes and flows out or something like that. Of course, you cannot perform this surgery on these patients. It means that there are abscesses in the form of cysts inside. Otherwise, it will spread. In such bad cases, if there are abscesses, cuts, drains, areas of discharge in the armpits, what you have to do is to remove the skin there as it is. You completely remove those abscesses, cysts, sweat glands in the armpit and do a skin patch there. That's a little bit more difficult work. It takes a little bit longer to heal. It's a little bit more expensive. But this is better. We have seen cases who has this many cysts and abscessed sweat glands in the armpit should have this operation and get rid of them. After having surgery and feeling relaxed, after healing, their quality of life will increase. I have nothing more to say about this. We also do something else to stop sweating. We also do Botox injections. Before I forget, let me mention this. I'm taking a look at my website. Now, a Botox injection to reduce underarm sweating is a very simple thing. We also do injections with short needles because Botox has to penetrate the sweat glands just under the skin. So we do it using very short needles. We pull the area that is causing the sweating point by point. We do Botox injections in the whole area. The effects last for 6 months. They do it constantly, and even they say we feel unwell from sweating in winter as in summer because, says the patient, my armpits get wet in winter and stay wet in cold weather. In other words, it is both wet and cold and we get sick from it, they say. Therefore, these patients absolutely have Botox done in winter at the beginning of the winter. The effect is 6 months, and since it is a non-surgical method, it is done on an outpatient basis in 5 minutes without any anesthesia. It is also done on the soles of the feet and palms of the hands. But there is one thing, the soles of the feet and palms are very painful. It is nothing like armpits. So when we do the Botox injections in the soles of the feet and palms of these patients, we definitely do it under anesthesia. We do it in the hospital. Let's call it a sedation. They'll give the patient a light anesthetic. We apply high doses of Botox to all points of the palm, soles of the feet, and spread it over the entire soles of the feet. We do the same with the palms. These patients were kept in hospital for 1 or 2 hours after the treatment, both in terms of relief from the anesthesia and because of the pinpoint small hemorrhages on the palms of the soles. A pad is placed under these, under the hands and the soles of the feet. And the bleeding is expected to stop. In an hour or two, there won't be much left. There's not much bleeding, but we'll wait another hour or two so that the patient can go out and walk around. They are released from the anesthesia and the puncture sites on the palm and the soles of their feet are healed within an hour or two. After that, we discharge them. And the effect is for 6 months. And this is also asked, is there any permanent method for the soles and the feet and the palms? Is there any operation? Unfortunately, no. If you want a sweat treatment, we can only do a Botox injection on those areas. There's no permanent surgery for this. There's only a permanent surgery for the armpits. That's all I can say about sweating. If you have any questions, please email me. I've forgotten one thing, by the way. I'll send it to you in response. If you would like to ask questions about these topics, I have all the contact information on my website. My email address and WhatsApp numbers appear at the end of the video, so you can reach me. You can ask questions here. When you send a question, please add a photo of the problematic area, if it's a visual problem. If I can see, I can answer more clearly. Also be patient, because there are too many messages. I try to answer them all in order. Sometimes it can take a week for me to reply. So I kindly ask you to be patient.